There we go. Sorry about that, folks. We were just having some technical issues, and we're going to get going in just a second, letting the room open up, and we'll get going. All right. All right, still climbing. We'll get going, and we'll let everybody else fill in the room in a second here. So good morning. I'm Paul Markle, Executive Director of the Barrie Chamber of Commerce. And I'd like to thank you for joining us today for this virtual town hall with Dr. Charles Gardner and Dr. Steve Rebellato from the SMDHU. We've also be having a few of our local chamber representatives joining us. Norah Fontaine from the Muskoka Lakes Chamber of Commerce. She's co-moderating with me today. Brenda Rhodes of the Bracebridge Chamber of Commerce. Sandy Lockhart from the Gravenhurst Chamber of Commerce. Kelly Haywood of the Huntsville Lake of Bays Chamber of Commerce, and Allan Lafontaine from the Orillia Chamber of Commerce. So thank you all for coming. I'd like to start today's session with a land acknowledgement. We are hosting this in Barrie, so we'll use ours, but certainly we're recognizing the lands in the other regions as well that involve our Indigenous and non-Indigenous peoples. So in keeping with Indigenous protocol and building respectful relations between Indigenous and non-Indigenous peoples in Canada, it's customary to acknowledge the traditional territories and ancestral lands of the Indigenous peoples. Barrie Chamber acknowledges this sacred land on which we operate has been the site of human activity for 15,000 years. This land is the ancestral land of the Wendat and Anishinaabeg Nation. The treaties that were signed for this particular parcel of land are the Williams Treaty, the Robinson Superior Treaty number 60, the Penetanguishene Purchase number 5, and the Nottawasaga Purchase number 18. We're dedicated to honoring Indigenous history and culture, and we also recognize the enduring presence of Indigenous peoples on this land. We're committed to moving forward in the spirit of reconciliation and respect. Miigwech. So the purpose of today's town hall is to hear an update on the current COVID-19 status in our region directly from Dr. Gardner and his colleague, Steve Rebellato, and for them to share relevant strategies for providing a safe holiday setting. The goal is to combat the spread of the virus and reduce workplace infections and keep businesses open. It's also your opportunity to ask questions and share concerns in a respectful manner. Quick housekeeping note, we're going to be using the Q&A for this afternoon's meeting, so please don't put questions in the chat, put them into the Q&A, and we will moderate those as we go along. The thing with the Q&A is we're going to get multiple questions that are going to be repetitive, so we're going to do our best to curate them as best we can, and we likely won't get through all of the questions, so we will compile those questions at the end. And have them added to a Q&A, which we will supply at a later date. Because we are interested in getting all of those questions answered, we want to make sure that we're not missing any. So at this point, to not waste any time, we're going to get right to the presentation. So I'm going to hand it over to Dr. Gardner. And we'll be back in about, well, I don't know, 15 minutes, maybe 20 minutes to answer as many questions as possible. So take it away, Dr. Gardner.
Okay, hello, good afternoon, everybody. First up, I'd like to thank the Chambers of Commerce and Paul in particular from Barrie to allow us this opportunity to engage with yourselves and provide an update about the situation for COVID-19 in Simcoe, Muskoka. And also would want to acknowledge my colleague, Dr. Steve Rebellato. So I am Medical Officer of Health for the Simcoe Muskoka District Health Unit. Dr. Rebellato is the VP for Environmental Health. I'm going to bring up a PowerPoint that we will walk through over the next 20 minutes or so. So just checking in to make sure that people can see that. Should be able to see that now. Okay. So we will be providing an overview with a lot of health data, but also something of the history of regulation here in Simcoe, Muskoka. This happens to be a picture of an oak tree that was completely stripped by the LDD moth in the spring, yet recovered and went through the remainder of the season. And in my mind, it is a symbol on my morning dog walks of recovery and renewal. But it's important to note that the world continues to struggle with this pandemic, the pandemic of the century, and Ontario actually this fall has done to date very well in comparison with a number of other jurisdictions dealing with the present Delta variant of COVID-19. So we are down at the bottom, and you have a number of European countries, and this is standardized data rates per population. So it's comparable data for case counts, for patients in the intensive care unit, and for deaths. So far we've managed to do well. It's been a combination of high vaccination coverage and maintaining public health measures to date. But we are facing a new challenge. One is that despite our control measures, we've seen a rise in the Delta variant, but now we have a new, what is almost certain to be more transmissible variant, Omicron, declared by the World Health Organization as a variant of concern on November the 26th, found to have numerous mutations, quite substantially genetically changed, some of which correlate with increased transmissibility or reinfection. And so we are concerned about increased transmission, a shorter incubation period, and more rapid progression, as has been seen in South Africa and now is being seen in the United Kingdom and Denmark. We don't know whether it is more virulent, whether it causes more severe infection on a case-by-case basis. Some have felt that it might be less virulent, but if you have something that transmits to a higher degree and potentially reinfects people and potentially evades the effectiveness of vaccine, at least to some degree, then you can still end up with a large number of severe cases, even if most of those cases are actually milder. So we are very concerned right now about the potential for this new variant. And despite a very prompt warning of the world by South Africa and response by the governments of the world and shutting down of flights and putting in place stringent screening protocols, it's here. We've got, as of 2 days ago, 40 cases that were confirmed and reported, but probably many more, including a cluster in Simcoe, Muskoka that is provisional. We await the confirmatory test, but almost certainly is, in fact, the Omicron variant. I think we can say that it will actually mount over time, perhaps very quickly over the weeks to come, and spread. So that's Omicron, and that's very much in the back of my mind. But right now we're dealing with the Delta variant, and what we have here is the course of COVID-19 for the past year. And you see that the most recent wave was kept controlled, going from the late summer and into the fall, but is now rising provincially overall. And when we look at our data provincially over the past month, we first off note that it's over 600,000 cases we've had to date, but the number of cases per day has essentially doubled. And very sadly, we passed the landmark of 10,000 deaths from this pandemic in Ontario. And in Simcoe, Muskoka, all the way along, we were at about half of the incidence of the province and about a quarter of the incidence in the Greater Toronto area. And so during the third wave, that's where we crested, and this is where the province was. But now in the fourth wave, we find ourselves in a completely different situation. We are more than double the provincial incidence of cases on a per capita basis. The health units to the south of us in the GTA are not experiencing this kind of wave. They're at the provincial rate or lower, though they too are rising, as is the province as a whole. We find ourselves instead in a peer group with health units away from metropolitan centers that formerly had much lower rates of transmission. Kingston area and Windsor, and health units in southwestern Ontario and in northern Ontario. Very different peer group. So for Simcoe, Muskoka, we've had 16,000 cases to date. Our daily case count essentially doubling from over a month ago. Fortunately, we've not seen a large rise of mortality to date. We continue to make progress to the best of our ability with the last mile vaccination strategy for reaching everybody 12 and above. And now have introduced, of course, booster doses, about to commence with 50 and above for that, and vaccination of children 5 to 11, very, very important to proceed in those fronts. But the last mile strategy for the remainder of the population getting their first and second dose is very slow at this point. It's hard to convince these people to come out and get vaccinated. And so they remain very vulnerable to all that is happening. One thing we noticed so far, severe cases admitted to hospital or ICU for the province has been stable, just now starting to rise, not markedly. But we don't have that experience here. The health units that are ahead of things are at the front end with the highest surges, are seeing a rise in hospitalization and ICU admission. Those that are ahead of us to the point that their systems are compromised, Kingston very recently having to ship ICU patients and transfer them out of district to provide for sufficient care. So we aren't at that point yet, but we are definitely seeing the rise in cases, not yet so much in the ICU front, but we watch this very closely. And when I liaise with my peers in hospital, both at RVH and also Soldiers Memorial Hospital, they note that they have a reduced capacity with reduced human health resources at their disposal compared with the previous waves. They're also at high occupancy, attempting to get to the backlog of care that has been put off because of the previous waves. And so it would not take much for them to end up in a situation where they cannot cope. Certainly as a health unit, we are there now. We're at the point where we really have to focus on the most dire situations for outbreaks, while keeping the schools safe and keeping our congregate settings safe, and are not really able to get to the other outbreaks and have a limited capacity to get the data required from the cases that we have. That certainly puts us in a vulnerable situation for being able to properly protect our public and to properly respond to the pandemic locally. So we have some vulnerability here now, and the health units that are ahead of us with higher case counts have gone through this phase and are at the point where they had to take more actions. So if we look at locally what we're seeing in the way of our cases, this is the present right now. And we're finding our cases happening, over half of our outbreaks, in primary care schools, because only recently, over the past 2 weeks, have we been able to offer immunization for children of that age group, those 5 to 11 years of age. So they've been a very vulnerable group for infection, and we've seen large numbers of outbreaks in our schools. We're committed to keeping them open because of their importance, but it's hard to keep them open with those outbreaks. We're also finding that close contacts and household settings, as all the way through the pandemic, have been important areas for transmission. We are finding that people are, maybe a third of our cases, getting infection and we don't know where, so somewhere in the community. And that does speak to community vulnerability. And then we have a variety of community settings, workplaces, in a variety of settings where we've seen cases occur. There are probably many other outbreaks happening in congregate settings and food establishments, and other workplaces and multi-unit dwellings and fitness centers, because we've seen the cases, but we can't really properly assess them to declare them outbreaks. So have a high degree of vulnerability happening here right now. And we find geographically, we're kind of alone in that the neighboring health units aren't like us. Our peers are those other health units elsewhere in the province. But in short order, we may find that those health units to the south of us catch up with us, if not because of Delta, then because of Omicron. So the question of where we go from here is certainly an important one, and all the way through the pandemic, the COVID Science Advisory Table has done mathematical modeling and projections and advised all of us and government about what is coming and what may need to be done. And their modeling generally has been very accurate. At times, it's been under calls, occasionally over calls. The last model they made was an undercall. Their high-end prediction was what actually happened. And now they have a model that takes into account what we're seeing with Delta, but also the potential for Omicron to impact. And what's really key is we need to get vaccination up for young children, and we need to reduce basically close contact interaction among people to help curb this rise. And even so, Omicron is just proving to be so infectious, we shall see what it actually does. So here we are compared with our peer health units. Here's the grouping above us, and Temiskaming to the far right, which has had a rise and then some fall. All of these are presently well above 100 cases per 100,000 population per week. The province is now sitting at 45. We're sitting at about 100. All of these health units have had to put in place letters of instruction that have included reduced capacity limits, putting back in place the capacity limits that were lifted from businesses over the month of October, with other measures as well. In some instances, gathering limits in personal settings as well have been put in place. Who's most vulnerable? The unvaccinated. So provincially, we see the unvaccinated have a much higher rise of incidence, higher rise of hospitalizations compared with the vaccinated, and now a rise happening in ICU admissions. ICU admissions happened late. People first get ill, then they deteriorate and have to be hospitalized, then they deteriorate further and end up in the intensive care unit. So there's a time lag before you see the full manifestation of things. But my key point here is vaccination certainly is very important, and we need to do all that we can to optimize it. And with Omicron, it'll be all the more important, and getting boosters when people are eligible to do so will also be very important. Locally, our data shows indeed those who are unimmunized have a much higher rise of cases, incidence of cases, compared with those who are fully immunized. So our pattern is the same as the provinces on this front. And we find that it is younger populations in particular with the rise, and in particular those who either cannot be immunized because they're less than 5 years of age, or only recently could get immunized because they were 5 to 11, that have had the highest per capita incidence. But other people, young adults and youth, also high. So it speaks once again to what can we do about a vaccination. We're looking at the population 12 and above, and we find that almost 88% have had 1 dose, and almost 85% have had 2 doses. You look at the older population that will have more severe outcomes, including a much higher mortality rate. They've largely stepped forward to get vaccinated, fully immunized 2 doses, and are coming forward to get their booster, which is absolutely critical as they become eligible, 168 days post-second dose. So we expect a large number of those being eligible shortly. But younger people need more encouragement to get vaccinated, in particular young adults and in particular young men. We're doing all we can now that children can be vaccinated. And so in the past 2 weeks, we've managed to vaccinate over a quarter of our child 5 to 11 population first dose. They'll need a second dose in 8 weeks. And we want to do all that we can to get that as high as we possibly can. So public health, the science advisory table on COVID-19 has a graphic in their most recent modeling document. It speaks about the multiple layers of protection that are required to protect the population. The most important is vaccination, but the other layers are all needed too. We do see some vaccine failures or breakthrough cases. Now about 1/3 of our cases are breakthrough. This is a function of the fact that the vaccine is not perfectly effective, but very good, but not perfectly effective. And as you get closer to 100% coverage, the cases that you will see will be breakthrough cases, but people need to physically distance. They need to use masks. Workplaces need to do all that they can to require this and have this built in, and to avoid large gatherings. So right now, we're really strongly advising that people shrink down their social gatherings at this time of the year and not go the flow that we normally do at this time of year with large gatherings. So at this point, I'd like to hand it over to Dr. Rebellato.
Thank you, Dr. Gardner. So what I'd like to petition to this group today, and first off, thanks again to the Chamber for organizing this. At this current time, we have two letters of instruction that are in effect. The two letters of instruction I think are most pertinent to this group to be able to flag. The first, as you see in front of you on the screen, is a letter that is tailored toward indoor organized sports and indoor recreational fitness facilities. Now, those of you that have been following along with our recent or previous letters of instruction will know that we had issued a letter of instruction on October the 14th that was specific to these similar settings, so indoor sports and indoor recreational facilities, whereby coaches, trainers, volunteers, and teachers within those indoor settings would be required to be fully vaccinated by November the 25th. So through this most revised or recent letter of instruction that was provided on November the 23rd, the tenets of the October 14th letter still apply. So teachers, to be simple about it, teachers, volunteers, coaches, and trainers within those settings still need to be required or would be need to be required to be fully vaccinated as of a couple of weeks ago on the 25th of November. So what's changed? And I think that was one of the questions within the chat. What's changed in terms of the revised version from a couple of weeks ago on the 23rd is that all participants that are 12 years of age or older that are either attending or involved in these types of sports and indoor fitness settings are required to show proof of vaccination in two specific dates. The first date is one dose as of December the 8th, which is, of course, yesterday or 2 days ago, sorry. And then the second significant date is to show proof of being fully vaccinated by February 16th. And the reason being is that we wanted to provide a sufficient period of time whereby individuals that are 12 plus can be fully vaccinated within the time period that it's allotted through Health Canada for those specific types of vaccines. Dr. Gardner, next slide, please. Thank you. So the second slide in regards to this is to fully acknowledge that there will need to be grace periods, as we've seen in various other organizations and health units across the province that have very similar types of requirements through their letters of instruction, is that we have this group that is turning 12 within the calendar year in which the letter of instruction will remain. So moving into 2022, we've allowed for 12 weeks for individuals that turn 12 in order to get fully vaccinated within that period of time. It's likely very important to note that spectators were always required to show proof of vaccination under the regulation. So nothing has changed there, nor is there any additional instructions provided within this letter. And the other piece I'd like to flag is through Dr. Gardner's letter to both the community and to our CAOs. He's asked for a couple of different things. To notify Simcoe Muskoka if a municipality or anybody for that matter is aware of any large community gatherings that are organized that would exceed 500 persons. Of course, some of these events are both indoors and outdoors, and therefore I think it's very important that we be aware of that. So that way we can obviously assist you with that. In some cases, businesses have asked for our opinion, and I don't think that it's untoward based on some of the data that's come forward that our recommendation is to avoid these types of larger gatherings at this point in time. And so that is the request at this point in regards to some of these larger gatherings. Dr. Gardner, next slide, please. Thank you. And so the second letter of instruction that was coincidentally released on the same day was a revised letter of instruction in association with a previously issued letter of instruction for businesses and organizations. Now, again, for those of you that have been following along with our letter of instructions, we have issued several letters of instructions to businesses and organizations in seeking assistance, specifically for these settings as regulations have changed quite frequently. And we can certainly attest that it has been a mirage of different requirements that have been required of organizations. And so the letter of instruction that is provided recently on November the 23rd does two things. Reinforces some of the very important requirements under the Reopening Ontario Act that serve to stop transmission in association with the virus. And then it adds on additional pieces that are required based on settings, based on epidemiology and the statistics that suggest where some additional measures are required. So let's start with the safety plans. This should come as no surprise to this group in terms of the significance of a safety plan or a plan in general for organizations. So safety plans include a whole host of things such as screening and distancing and face coverings, proof of vaccination, cleaning and disinfection. All of these things work together. And in order for any type of business or organization to have things in place, a plan is of course required. And that is not only required through this letter, but also in the Reopening Ontario Act as well. I believe there's a question there in regards to enabling remote work for workers. Now, the text there says where reasonably possible. I think one has to be reasonable in terms of its application, where certain occupations, it simply doesn't work for them to be able to work remotely. But if an organization has the ability to allow for its workers to work remotely, that is, of course, ideal. It avoids all types of those risk factors, including people getting together, people congregating, where we know the virus transmits quite easily, even with some of the safety provisions in place. So we implore businesses to enable this type of remote work now, previously, and moving forward as we start to tackle this most recent wave. And then active screening for employees. This is somewhat of a new requirement in regards to the regulation required certain settings to have active screening in place. This was a regulated requirement. What we did is we added a few different settings, including places such as indoor playgrounds and faith-based settings, in order to ensure that active screening takes place. And this is something that several organizations have asked, well, can this happen remotely? Yes, but somebody ultimately needs to be able to vet those questions, whereby if someone answers no to some of these questions, there is some type of intervention in which the employer is saying to the employee, you have failed the screening and therefore you should not be at work at that point in time. Next slide, Dr. Gardner, please. Active screening and obtaining contact information. Again, this is an additional requirement that not only currently exists within the regulation, but also for the settings that I previously mentioned is in addition to active screening. I think everyone is keenly aware of the importance of that. Obtaining contact information is equally important, not only for the business to know who was there, but in the event that there is some type of outbreak or transmission takes place, whereby the health unit becomes aware of that, we would be going back to the business in order to say to the said business, we need to know who was there on those specific dates in order to advise them or warn them in regards to the potential for transmission that may have taken place based on a number of different factors, including the time in which they may have been there in association with someone who was positive at that point in time. Face coverings, again, this is not something I think is new to this group as members of the public or businesses or organizations. In public areas, face coverings are required at all times in terms of their requirements under the regulation and under this letter of instruction. Of course, there are exceptions. I won't line list them here, but as an example, there are some limited exceptions, including medical exceptions, in whereby individuals, employees, or members of the public may not be able to wear masks. These are limited, they're rare, but they are part of the regulation. Question that usually comes up is about non-publicly accessible locations. Now, a couple of different things. I would say that certainly we would continue to recommend wearing face coverings at all times in association with the regulation, where there is sufficient distance, 2 meters plus, between employees in those areas that are non-accessible. Those are not required under the regulations, but we would continue to implore and recommend that face coverings be used at all times in order to reduce that risk. In certain settings, eye coverings are required as well in terms of different occupations where there is very close contact with someone that's not wearing a face covering. Next slide, please. So this is a line listing of a number of different minor points in association with the letter of instruction. Physical distancing, again, things such as limiting contact with individuals, one-way walkways, staggering shifts, spacing in break rooms. This is all intended in order to reduce capacity within these types of indoor environments in particular. So we would implore you to use some of these techniques in order to avoid those interactions with employees. Posting of capacity limits. There are exceptions in association with the posting of capacity limits for certain settings, but for the most part, in generally, capacity limits are required to be posted in most businesses. Things such as using alcohol-based hand rub, minimizing instances in terms of work vehicles, where if there's more than one person, masking is otherwise required. HVAC system maintenance, I think this is, again, something that is likely redundant for most of you within the business community, but the importance of HVAC systems has been widely publicized in the media and through science tables about its importance moving forward. And certainly this is something that we would also recommend moving forward, and is a part of that letter of instruction as well. And as I had mentioned, contact information is available for all workers. There are some workplace settings in which there are secondary or tertiary types of businesses that have subcontracting relationships. Ultimately, the business responsible and the individual responsible for that business has to know who is working at their business on a certain point and certain date and time. For the purposes of contact tracing, in the unlikely event that we do need to contact you if there is an outbreak or transmission happening within that workplace. Next slide, Dr. Gardner. And I believe it is back to you.
So just to take us to the end here, I did issue a week ago an open letter to businesses and to the community, indicating essentially the situation that we have at hand. Citing the previous letters of instruction, the importance of abiding by them to the utmost, and the very real possibility of having to put in place with a letter of instruction capacity limits. On top of that, I'm now citing the potential to require gathering limits as well, which has been done in some other health units. So that takes us to our very end. We are in still the fourth wave, but now rising again. And this has been driven primarily with infections of the unimmunized, but about a third of our cases are immunized, and primarily by younger people because they have lower rates of vaccination coverage, essentially. But the vulnerability is there as cases rise. And we are seeing it spill over into affecting hospitals. And we now have on the horizon the Omicron variant that might very well drive yet another wave of cases. Public health, we're compromised now with our ability to keep up with things, but we do all that we have to do to the best of our ability. It's a very complex response we have. And the question that faces us immediately is whether to proceed with further capacity limits. So at this point, I shall stop sharing my screen. We'd be happy to take questions or comments.
Well, thank you very much, Dr. Gardner, Dr. Rebellato. We appreciate you putting the presentation together in a very comprehensive manner. In our discussions prior to this, we're as a chamber network, this is a topic of conversation every single week, and obviously our goal here is to advise business as best we can. We have to keep these businesses open. There's not only the medical component that the virus takes. There's also the mental health side of it, and also the impact to our economy. And that's kind of where we want to focus our questions as best we can. You know, if you go through the quick Q&A in here, there's a lot of stuff in here that's related to science, and we're not scientists. We're not trying to be. We're not trying to push that in any way, shape, or form. But we are trying to facilitate, answer questions, take the burden off of the health units in whatever way we can, and in staying up to date. So we're going to go through a few questions here. Norah and any of our panelists here are welcome to jump in at any point and ask a question. It's not the Barrie Chamber show. This is an opportunity to get answers across a very wide geographical area with very different demographics. So not everything applies as readily as it does in Barrie to other areas. But you know, with that in mind, you know, some of the stats that you put up were very interesting. And one in particular where, you know, you say that we're at about 100 units per 100,000 or 100 cases per 100,000. And at some other areas that have been in, you know, restricted or had additional restrictions are higher than that. At what point do you see that we are approaching that? And you know, obviously the discussion today is about how to prevent that, and hopefully our businesses are paying attention. But where's the data? You know, when does the data turn your mind and say I have to take action?
Yeah, so the province doesn't have clear indicators for us to work with, and thus we have to compare notes as health units. So we've formed a peer group of those at the high end in order to compare notes about things. But the sense of it that I see is when hospitals have great difficulty in continuing to function, that certainly has driven action in places such as Kingston, where they went from a very short time, within a week or so, from having stability to having to transfer ICU patients out, and led to the medical officer of health who did not want to go with capacity limits going with capacity limits. So that would be, I think, a really key indicator. But even that, I think we need to think about just the well-being of the population as a whole. So the two of those factors are very much in my mind, and I maintain very close communication with my peers in Soldiers Memorial and RVH to get a sense about the impact on the hospital. A third factor for us is our ability to function as a health unit and to keep up with cases and keep the community secure. And that is now very compromised. So I don't have a clear indicator, but I think with all of that's happening, and this new factor of Omicron that I expect will actually progress rapidly, we are being pushed, I think, rapidly in the direction of making this decision.
Okay, and that's you know, obviously it's disappointing for businesses. We've worked so hard to get ourselves to this point. It's something we want to avoid. So, you know, the Omicron variant, you know, is this something that our rapid screens are going to be able to detect? You know, obviously, rapid screens are something that are out there. That's in the news at the moment, and I've got a dozen questions in here with regards to them. Maybe you can speak to that just a little as far as their effectiveness. And obviously, the Chamber's been very aggressive with this program, and not something that we're always on the same page with you, but they are what they are.
I would like to applaud businesses for doing all that they can to keep themselves safe, their work environment and their clientele safe, and testing is something that many have taken on to do that. My understanding from Public Health Ontario laboratories is that, to the best of our knowledge at this time, those tests are still accurate against this new variant, but the incubation period for the variant is probably very short, perhaps 3 or 4 days, as opposed to up to 10 days or 14 days with the original variants. And thus you can easily miss with a test somebody incubating and about to become a case, and they remain infectious before they emerge with symptoms. We don't, perhaps that has changed, maybe not. We don't know yet about Omicron. And we've seen a doubling time in South African data, the UK, and Denmark, of 2 to 4 days, which is astonishingly fast growth. So I think we'll be very hard pressed to actually keep up with it.
Okay. A good knowledge. I mean, again, the capacity within businesses to test more often is there. Certainly the supply is there as well. So that is that possibly an option and something that could help? Yeah. Okay. I'm getting a nod, but not necessarily a verbal answer there. With respect to, office spaces, the letter of instruction talks about, doing whatever's reasonably possible. And I think that concept is, it leaves a lot up to interpretation, and that's where businesses struggle a little bit with. The answer is always going to be, well, we're okay. We don't need to do that. And that may be where we're running into problems. Can you maybe add a bit more clarity to what you mean by reasonably possible? I think maybe this question is for Dr. Rebellato.
Sure. I think, Paul, you'll probably hear me repeat some of what I've said before. I think each and every business has its own limitations associated with that. I mean, we're lucky enough in our health department to have an IT department who has assisted us along the way in enabling us to utilize remote work like today as an example. And of course, that's been successful. There may be limitations associated with other businesses. I think the fundamentals of this is that it's intended to enable these organizations to utilize this, there is not an absolute requirement that members of your organization come to work. And if they are able to perform the functions and duties of their position remotely, we would highly recommend that take place at this point in time in order to assist in stopping the community transmission that we're seeing at this point in time. So it is inching our way towards that. And certainly we recognize some of the limitations associated with it, which is why it's not an absolute. But if it is possible, it will only serve to help us along the way in reaching our goal.
Okay. And I mean, to be more specific, I mean, are we looking at larger, facilities where there isn't that ability to space out? Using chambers as an example, I have 6,000 square feet individual offices. We use all of the measures in between the offices. And we can work basically away from one another, but our business operates much better when we work together. So judgment call in that particular situation.
Yeah, and I guess my only retort to that would be, I mean, square footage is often used as an ability in order to reduce risk, and it does provide that, but there are ample other opportunities in which interaction occurs within these businesses and organizations. Lunchrooms, hallways, the water cooler, getting together after work, which makes it much easier if you're all in the same office setting. I think it really comes down to the fundamentals that I've spoken to, which really says, if you don't need to be there and your business can operate by doing that work remotely, we would highly recommend and encourage you to do that, because it stops the chain of transmission and gives people basically no ability to be able to interact with their colleagues, because it's just you and the dog at home, and that limits things for certain.
For sure. So sort of shifting a little bit, one of the concerns as well that we hear a lot is, when we add more restrictions in and not allow people out into restaurants or into congregate settings, it forces them, at home or to break rules. I mean, and we've seen that time and time again. 20 months plus into this, people are tired. They're not necessarily following the rules. Can you speak to that? Because I mean, it's a very real danger. I mean, I have personal anecdotes. I think everybody here can talk about personal anecdotes about, and to that matter, businesses that aren't necessarily following the rules and creating those kinds of environments, which creates an imbalance even in the business sense that this business is doing it and taking people on and this one isn't. Where's the compliance side of it and the enforcement to help businesses along? Because in a large part, it's been a little hit and miss. Even if you look at the SMDHU's hit list of businesses that have been impacted, there's not a lot there really when you look at the amount of time that we've had with this going on. And this isn't a criticism, it's just discussion.
Perhaps I would reflect that I sympathize with the pandemic fatigue that we all experience. Certainly personally, I experience it. There's nothing more that I would like than for this to be over and for all of us to be able to go back to our normal lives, and myself included in that. I go back to our normal business and public health. So it's been very, very tough, and it doesn't appear to have an end in the immediate future. We face yet another variant before us. So The challenge continues. We've never been resourced to the point that we could take a strong enforcement approach. We've had to rely on mostly people's willingness to follow the rules, the requirements, and to understand why they're needed, that it's ultimately for their own protection that these things are put in place. We can respond when there are complaints, but we're limited in our resources. And we have seen with every shutdown that the province has had to do that it has brought down the surge. So that would never have happened if there wasn't a high degree of compliance, a reasonable degree of compliance. If nobody complied, that just wouldn't have happened. It would have kept on going. Dr. Rebellato, would you have more that you would reflect on this, given the leadership role you play in our agency with enforcement?
Yeah, thank you, Dr. Gardner. My only reflections is that, I mean, I suppose the easy answer is sheer numbers do not support our ability to be able to enforce the way in which philosophically we would. I mean, well over 4,000 businesses across, the district and county, and really only, roughly about 30 individuals to be able to do that across the board, and certainly that does not, the math doesn't really add up. But what I would say is that any such restrictions, either provincially or locally, that have been applied have never been done in unison. So I would say that any such direction through the medical officer health, through Dr. Gardner, that has spoken to businesses is always coupled with a personal plea as well, as it relates to one's homes, reducing one's social circle. And we're seeing that right now through Dr. Gardner's recent open letter, which doesn't just speak to businesses. It also suggests, listen, going into the holidays, you will want to shrink the number of individuals that you gather with. So, there are obviously restrictions associated with, going to people's homes and making sure there is compliance, but that communication message doesn't change, whether it be for business or personal circumstance, whereby it's saying getting together in public in larger numbers is not a good idea. And that goes for both one's home and one's business as well. So that message certainly is understood, Paul and group, but it also equates to both types of settings. Yeah,
understood. And again, I mean, that's the the real reason we're here is to amplify that messaging and to reinforce the fact that we still need to be diligent. We can't let our laurels go down as much as we'd like to. We still have to stay diligent in everything we do. There is a question that was one of the first ones that hit the screen here with regards to QR codes and an announcement that's going to be made later today. Can you speak to that at all?
In my mind, certainly proof of vaccination was a critical contributor to the control that we've seen so far, in the fall. And it was something that the local public health community, public health across the province, was advocating to the province, and we're commending of the province when they did it, and having that operate to the utmost is important. We hear anecdotally of people that do workarounds and don't comply, or businesses that don't comply, and that certainly would undermine the effectiveness of it and might very well be contributing to some of the exposures and transmissions that we've seen in those kinds of settings. So what the province can do to act on that, I think, is welcomed. What I would say is that it will take more than that. It's going to take all of us doing all that we can, the kind of measures that we described today to respond to the surge that we have now and respond to the Omicron surge that we anticipate.
Okay. I have a number of questions in here, and I mean, we take a lot of questions, and I mean, there's a lot of frustration in the restaurant industry, personal service sectors. Those are the ones that have been hardest hit through this entire thing. The plea from them is that to be as far in advance of making these announcements as possible, to give them opportunity to do the things that they need to adapt. I mean, even going to a 50% capacity in those types of settings is going to be devastating, and we will see a massive impact from an economic standpoint. So I would ask on behalf of the business community that if you decide to go this route, that you give us as much notice as you possibly can, to give those businesses an opportunity to pivot and make the adjustments that they need to. In terms of RVH, there's always questions about capacities and things there. What's their limits as far as in terms of when you're going to start making a call with hospitalizations? Do you have that number, or is there any indication from them as to when it would become critical?
In my communications with them, their indication was that they're pretty well at limit because of the combination of COVID, but also just what they have to do the backlog of healthcare that has been put on hold. They're at the limit now, and that and challenges with human health resources, fatigue, and having further increase, even an additional 2 ICU cases would strain them further. So that is the sense that I've gotten from them very recently, just this week.
Okay, so I mean, we're getting to that tipping point. It's disappointing, unfortunately, that's happening. So we've got a couple of minutes left here, and I sort of hogged all the time here. Are there any questions from any of our colleagues here that I haven't hit on? When you start going through the Q&A, 30 plus questions, a lot of them are similar, a lot of them are science-based that we're just not going to get into today. I will say that we will have those questions sent to Dr. Gardner and Dr. Rebellato. We'll wait for response back for them, and we will get answers back on those questions specifically. It's just unfortunate we have an hour today and we can't get that all done. But anything from Brenda, Norah, Sandra, Kelly, or Allan?
Dr. Gardner and Rebellato, thank you so much for coming and sharing this. And it's certainly everybody talked around the table about the importance of getting this message to keep businesses open. I think the net impact of closing them down, especially at a time of year where they've been already through this once, is so important. Is there any information on transferences with businesses that are customer based? Certainly restaurants being shut down and targeted in gyms, even with the factor that we got to keep people physically fit. Do we have that data? Is there somewhere that we can get this data to keep our community safe, one, and two, to figure out what do we do in the next turn? Obviously, viruses are going to be with us for some time. Air circulation, ventilation systems are so important. But I think the more data we have, we've all kind of become, we joke about this, we're not scientists, but because of all the information that we've had, we're capable of getting more information. So just your feedback on that. Thank you.
So thank you for your question. Would the question be, what do we know of the other impacts beyond the disease itself on the population? Would that essentially be it?
No, the data for business, like you have on your screen, it showed various contact points, but we don't know, we haven't seen the actual data of what businesses are transferring. What are the biggest concerns? Like I would imagine grocery stores are probably one of the larger places that people go to where too many people are in there. But I'd like to see the breakdown of what businesses.
So we found that congregate multi-unit dwellings has been a location. Food establishments in general have been locations where we've seen a lot of exposures. We haven't been able to confirm the outbreaks because of our limitations. The outbreaks we've concentrated on have been in schools and congregate settings. And also fitness centers and hotel-like establishments are some of the locations in which we've seen the largest numbers of exposures. So would that be the kind of information that you would be seeking? Yeah, we put up on our website all kinds of information, including fairly detailed analysis about outbreaks. Unfortunately, when we get to the point where we can't confirm outbreaks, what I've just cited to you, these exposure sites, we haven't been putting that information up to date on our website. I guess I would take under advisement the potential to do so, given your question. I don't
Yeah.
know, Dr. Rebellato, perhaps you would have further reflections on this. I don't know.
Yeah, thanks,
You
Dr.
certainly
Gardner.
get
Thanks.
plenty of calls to your department.
Yeah, certainly. I think, you know, the ultimate number of calls has increased as our cases increase. I think that there's a close association with that. As Dr. Gardner referenced on, and if you just simply Google Simcoe Muskoka District Health Unit health stats, you will quickly see a number of different data points associated with outbreaks and trends over time and geographic distribution that I believe you're speaking to specifically. But I would say that one needs to look at the outbreaks in particular as not a moment in time. So you will see various industries listed there, from workplaces to different industries in total, but recognizing, of course, that once someone becomes positive, they just simply don't go from work to home. They are members of the community just like we are, and they go out to different places, and that's where that transmission continues to take place. So it is not a very linear type of assessment that takes place. I think in all cases where we have followed up with members of the community, I'm sure Dr. Gardner would agree with this, is that what we're seeing is that there is never just one exposure site. There are, in most cases, several, from people's homes to different businesses. And therefore, that's how we get to a point in which that community transmission is observed.
Okay. Nora's got a question here with a bit more specific on restaurants. Go ahead, Norah.
Yes, well, we've touched on restaurants. There's a couple of specific questions in the Q&A. We have a Gravenhurst restaurateur who's saying that for restaurants, she believes it sounds as though you're leaning toward a 50% capacity limit with 2 meters between tables. Can we say that that is probably coming, and if so, when? After we hit that 100 mark? I know it's already been answered a little bit, but can we nail it down a bit, Dr. Gardner?
Yeah, thank you for that. And, noting Paul's comment earlier that forewarning is much appreciated, I guess I would say that I think this is likely to happen. We would be using like 2 meter distance restaurant approach and 50% capacity in other venues, akin to the regulation that had been in place in October. And it will probably come very soon. We haven't yet made the decision. I can't tell you precisely when, but I hear that you would want advance warning. And I think it's important for people to know that there's a high likelihood of this coming and coming soon.
And certainly, Paul definitely covered the fact that this could be a final straw for some restaurants, and that they do need that length of time to be able to pivot. We've seen it happen in Sudbury when they had the extra restrictions, holiday parties. One high-end restaurant lost $30,000 and had, immediate cancellations on the very first day. So it is a real threat. Now, I want to also speak to a very specific thing. We have a question here for church dinners at Christmas. Should they be putting a plan B into place? And if we follow all applicable rules, can we still continue to give Christmas dinner to those who are alone or less fortunate? So a two-part question. What should they be doing about these holiday Christmas dinners? And then can they still potentially at least provide, maybe they need to pivot in providing takeout to the less fortunate. What would you say to that, Dr. Gardner?
I think a precautionary approach would be pivoting and doing takeout. With regards to, if they insist, what would be allowed? I think that Dr. Rebellato would probably be well equipped to speak to, with the kind of regulation we'd be looking at, what they would be allowed.
Yeah, thanks, Dr. Gardner. Certainly the setting is of utmost importance. I think Dr. Gardner positioned it well, where if it is, for the purposes of simply congregating, for the purposes of celebration, that is one in which you will probably see very strong language associated with recommending against that type of congregation. The letter will speak to the specific setting and the requirements of percentages for capacity. So that is the easy answer. I think from a food security perspective that you've spoken to, Norah, that is the pivot that is absolutely necessary. Certainly none of the instructions we would put out would want to inhibit that type of approach. And, you know, certainly the risk is significantly reduced if it is simply just a delivery to individuals. And we would obviously advocate in terms of moving in that direction.
Okay. There is a specific question here with regards to transmission in unvaccinated population. The question is, if the majority of transmission is occurring with unvaccinated population, how will limiting capacity in locations that require proof of full vaccination help? I think you've answered this, but just to be more specific, because there is some unclarity with how that all works.
Well, beyond a doubt, in my mind, proof of vaccination made an important contribution to the control we saw in the fall. At the same time that Alberta and Saskatchewan had an enormous rise and got to the point where they had to transfer ICU patients out of province. And the rise that you saw in the data in Western Europe that's happened, we had the same variant and we did not experience that, and all that we did contributed to that. And so proof of vaccination was an important contributor to that, but it's not been perfect. We have seen clusters of cases that were probably outbreaks in some food establishments, restaurants. I think some of the weaknesses there would be proof of vaccination is required of patrons 12 and above, not children. So children could be a source of transmission, and not employees. We've advised that you have policies in workplaces for the employees, but that requirement is not there. The province chose not to make that requirement. And so that's yet another means by which transmission can happen. And then you have breakthrough cases that can occur. If you're vaccinated, if you're not vaccinated, you're 7 times more likely to become a case and 15 times more likely to be admitted to hospital. But you can still become a case if you're vaccinated. It's just the risk is much less.
Okay. Thank you for that. We're actually over time now by about 10 minutes. We started a little late, but are there any final questions before I wrap this up? I do want to thank you both for being here today and providing this opportunity to have a dialogue, and I hope that it's the beginning of of many more of these on numerous subjects that I think the business community can be a big help with, and for us to be able to help clarify where there are questions. I do apologize to everyone that was in the audience that we didn't get to your question or we didn't get to all of them. There just isn't enough time, but we will have a response for you shortly. So before I wrap up, anyone else have a final comment?
We'd like to thank you once again for the opportunity. I really appreciate the two-way communication. It's very helpful to us.
It is, and we appreciate you making yourselves available on such short notice. This came together very, very quickly, and that was very much appreciated. But again, I think we need to be moving quickly to be able to have an impact. So again, thank you. So with that, I'm going to, in closing, like to share you all for your expertise and insights with us today. Thank you to our audience for joining us and for the work that you're doing in your business every day. Thank you for the work that you've already done to protect our community. Please continue out there to shop local, support your neighbors, families, and friends with intentional purchasing decisions, especially as we head into this holiday season. If we are going into any kinds of restrictions, it's more important than ever to make sure that those dollars stay on the ground in our communities and we're supporting these families as best we can. If we do go into lockdown, drive up, get takeout, don't rely on these delivery services, keep those dollars in those restaurateurs' pockets, buy gift cards, do whatever you need to do to be able to help those businesses out in this particular situation. Again, your local chamber, and I'm representing all of us, and the entire chamber network is here to help you and your business succeed. Please feel free to email or call if you have anything more, and please have a safe and happy holidays. In the words of Rocco Rossi, our fearless leader at the Ontario Chamber, stay positive and test negative. Have a great weekend. We'll talk to you soon.
Goodbye, everybody.
Paul, just one quick question. I'm not sure how we can capture the questions in the Q&A, so I'm hoping that your staff has captured those so we can try to get answers back to everyone that asked their questions.
Yeah, we'll do our best to save that. And again, I'll do a screen share actually, just so I have it. So yeah, we can close this up while I get that done and go from there, just in case this doesn't work.
Thank you for playing host. Thank you,
Yeah,
Dr.
you're welcome.
Gardner. Thank you, Steve, and everyone for coming in today, and have a happy holiday.
Likewise. Have a
Thank
good,
you,
good
everyone.
holiday, everybody.
Stay safe.
Good stuff. Have a good day.
Bye-bye.
Bye.
I think it's just us now. So I had to do that because I was afraid that you'd end the meeting and we'd lose the questions.
Yep. I'm just
So
gonna
I'm
turn
assuming
the,
a couple of your assistants are on as well. So I just didn't see, like in a chat, you can grab the text, but I couldn't see how you can grab the questions.
yeah, we're still live on Facebook. Nora, just give me a second.
Okay.
Can ladies, can you just stop the recording?
Oh, we should have thanked the people on Facebook too.
There we
Okay,
go. Yeah, we're recording, but we're not on Facebook. Yeah, that's fine. They'll figure it out.
that's okay. I'm not worried
Yeah.
about it.